holography-guided lap and robotic surgery boosted spatial perception using VR and metaverse. Image-guided surgery are often used to assist in understanding the complex 3D anatomical structures in individual patients. However, 3D reconstructed image from CT or MRI have only been presented on a flat 2D display, which cannot accurately represent the actual spatial location of the organs, lesions, and surgical instruments. So we applied a holography like 3D guided to organs, lesions, and procedures based on the 3D MRI images of the individual patient to create a stereoscopic view in real space above the surgical field to allow viewing in all directions. So we aim to develop a holography-guided surgical navigation system powered by the metaverse platform, designed to improve spatial awareness during GI and HPB laparoscopic and robotic procedures and assess its efficiency. We conducted 30 endoscopic, laparoscopic GI and HPB surgeries using the metaverse-based holography-guided surgical navigation system. The 20 Asian surgeons utilized the head-mount display using the surgeries. The holographic 3D guide of organs, lesions, and procedures were constructed based on individual patient CT and MRI images, rendering a true-to-life 3D view in real space above the operative area. So we developed a web-based XR application named HoloEyes. From CT images, organs and lesions are extracted into a colored 3D polygons. We reconstructed it into virtual and real space using our original web-based XR application. We have integrated a commercially available cloud service that accomplishes XR in only 5 minutes. Position sensors input from spatial 3D cameras and infrared light depth sensor allows gesture manipulation of the holographic organs while wearing the XR goggles. It was better to represent virtual 3D models in the space beside the endoscopic display than superimposing them on the actual surgical field of endoscopic and robotic surgery. You may add the arrows or letters and annotation on the patient data, and you can merge your own finger shape. You can remove the organs like a surgical simulation. Using the polygon data of your instrument, you can move the organ and your instrument like a forceps, like a simulation. This is the surgical simulation for esophagus cancer surgery using the thoracoscope. In all surgeries, tumor lesions, organs, and blood vessels are accurately rendered as holographic images in the sterile space above the patient's abdomen, along with resection lines to guide surgical approaches. The system setup took less than only 5 minutes on average, and no post-operative adverse events occurs in any patient. Compared with conventional navigation system, this is far easier and cost-effective to introduce. Spatial awareness, immersion, and interactivity were enhanced. It provided us better sense of presence and realism. In addition, the user can move around the VR space. It improved the selection of the resection area, advanced of anatomical misidentification, unnecessary bleeding, and miscommunication in laparoscopic and robotic surgery. And you can record your hand movement of the procedure to the patient data using this kind of metaverse system. And you may upload your own procedure to this patient data, and you can record your explanation and movement of your hand and the gaze line. And you can relive these data using the head-mount display. So you may add this recorded data to your smartphones. Using only $1 paper burgers, you may use your own smartphone VR system. The authentic 3D avatars of the surgeon were created, enabling remote surgical planning and discussions in the metaverse. And this young surgeon are now learning much about robotic arm movement. He is now following the movement of the robotic arm with his controllers with a head-mount display. In the metaverse, surgeons can see where they are looking the organs they are working on and their hand movements all at the same time. They could also feel what other surgeons were doing by overlaying their own hands and feelings onto the hands and organs shown by avatars. This way, they could learn and share unspoken skills in surgery more easily. Holographic avatars elevated efficiency and effectiveness of reviewing, brainstorming, and sharing virtual content. Holographic guidelines allow surgeons to share their position and hand movements, demonstrating their utility for practical training. So we already published more than 37 papers in English, also in Annals of Surgery for liver surgery. This is the puncture for ICG fluorescent guidance for hepatectomy. You may put a holographic guideline on the patient for laparoscopic surgery. You can see the alignment of a puncture line on the patient's body, even using laparoscopic ultrasound. So this is the TME, electric cancer surgery. You can know much about the location of the perianus muscles, and you can merge the arterial structure on the laparoscopic monitors. And in Japanese, we already published more than 74 papers. In conclusions, our external supported holography-guided surgical navigation system fostered holographic telepresence through AR, transforming the operative room into a 3D workspace by allowing users to remotely connect and interact with their avatars regardless of the device they use. Our system has enhanced surgeon spatial awareness and reduced stress. Thank you very much. Thank you for attention.
Thank you.